I'm here today to introduce myself as the new LSU Pennington Biomedical Research Center Executive Director. It's an honor and a challenge indeed to hold this position, because when I think about the past 30 years of leadership that was provided to the center by internationally renowned scientists administrators that included the likes of Drs. George Bray, Claude Bouchard, Stephen Hamsfield, William Cephalou, and most recently, Donna Ryan. It is really big shoes. Those are big shoes to fill, but I look forward to that challenge. And even though, as Bill mentioned earlier, I come from the Cleveland Clinic. Cleveland Clinic was named the #2 healthcare system in the U.S. today. It is a big enterprise. It prides itself on its reputation, its brand, and its position in the healthcare industry. But I was really excited by this opportunity to come to Baton Rouge to step what I view as stepping up into a position with this world-renowned institution that has met the mission of its founding philanthropist, CP Doc Pennington. And that mission was to become the biggest and the best nutrition research center in the country. So maybe that statement about our status in the country doesn't surprise this learned audience, but it's amazing to me how many people I have met so far in Louisiana who are surprised when I mention that. And how many are unaware of the biomedical research powerhouse that's operating off of Perkins Road in Baton Rouge. Now, the U.S. National Institutes of Health, the U.S. Department of Defense, the USDA, as well as over 80 companies, private industries, have been well aware of Pennington Biomedical for a long time. Collectively, these organizations have tapped the center to conduct more than 1,000 sponsored studies, 600 clinical trials since 2003. The center's faculty have worked on research projects with more than 300 institutional partners across 24 countries. It's pretty amazing. They have published over 5,000 articles and been cited in the scientific literature more than 128,000 times over the past 30 years. So you can see from those numbers that the scientific community is obviously well aware of Pennington Biomedical. So besides introducing myself to you today, my second goal here is to begin a more aggressive effort to share information with the wider Louisiana community about this incredible resource we have right here in Louisiana, and to tell you why this resource is more important now than it has ever been before. So I'm sure a lot of you tune into your newscasts and your news shows, and you're well aware that there's a lot of talk about the state's billion-dollar fiscal cliff. And this is a very important consideration, certainly. But there happens to be an even bigger number to lose some sleep over. And that is Louisiana's $10 billion chronic disease problem. Let me illustrate. Louisiana, like many of its neighbors, has a weight problem. And this is happening all across the country. So if you see the progression on this slide, it's a map of the U.S. from 2011 to 2016, 5-year span of time. The color scheme is changing from green to yellow to red. For those who can't see the numbers, the red on the slide shows where over 35% of the population report being obese. So you can see this pocket down south in Louisiana, neighbors in Mississippi and Arkansas. There's been this progressive increase in obesity. And we can look at this as an obesity tsunami that's been drowning the country. And this, of course, has implications for the many diseases that obesity is linked to. Louisiana is being heavily impacted. and the consequence is an increased drain on budgets as we strive to cover the cost of these diseases. So let's take a minute to consider the connection between obesity and chronic disease. As many of you know, obesity is a disease that has very clear genetic factors that contribute to its incidence. But it also has behavioral factors such as nutrition and inactivity, factors that we can positively impact through evidence-based nutrition recommendations, tailored activity recommendations, and other therapies. And I would like to reiterate that it's important to know that obesity and chronic diseases like cancer and diabetes go hand in hand. Here in Louisiana, the Centers for Disease Control report that 50% of the population is affected by diabetes. This number is supported by our own population surveys as well. The costs to treat are staggering and range from $5,000 to $20,000 per year per person. Worse, the cost of human suffering, shorter lives, disability, blindness, pressure ulcers that won't heal, and limb amputations. I'm sure many of you have family members who are suffering from or have suffered from diabetes and are familiar with these problems. So diabetes is just one of the chronic diseases we're fighting. Here are the annual costs associated with the top three. This is a $10 billion chronic disease burden that Louisiana citizens, includes you, me, our employers, and insurers, carry every year. Well, I wouldn't be here today if I didn't think I had some of the answers to this healthcare crisis. One thing we know is that biomedical research will have the breakthrough science needed to resolve this problem. So discovering those answers is the first thing we need to do. Getting the answers from the bench, from the laboratory, to the bedside, and translating them out to the community is next. And biomedical research can help do both to improve the health of Louisianans. Well, this is where the answers begin. If you haven't visited us in Baton Rouge, we have included an aerial view of this 222-acre campus in your materials. This is a facility that's brimming with 40 state-of-the-art laboratories in 13 buildings. One of the biggest, not only in the country, but in the world. This is accented by a 68,000 square foot educational conference center that houses national scientific symposia as well as educational conferences for the public. And it seems to me appropriate that the buildings are set on what was once LSU Ag Center farmland. Because to use an analogy, the seeds leading to better health that were planted here over 30 years ago continue to grow and prosper and will bear fruit for years to come. Let me give you an example. Maybe you've heard about the DASH diet. It was just announced as the #1 diet for the 8th year running by U.S. News and World Report, based on a study that proved that many people wouldn't need their blood pressure medication anymore if they followed this flexible diet plan. That research started back in 1993 in one of those buildings and is being recognized and used today to improve health. What isn't pictured here are the scientists and staff, nationally and internationally known, along with their cadre of postdoc students who have come here from all over the world in order to work in the LSU Pennington labs, in the clinics, and in our community. And what are these scientists here? Why are they here, and what are they doing? Well, I can tell you that the fast and furious search for answers by these scientists at Pennington Biomedical never stops, because our scientists know that biomedical research is the key to conquering these chronic diseases that are contributing to our healthcare crisis, now more than ever before. Also, what you didn't see in the photo are the 44,000 participants in clinical studies over the past 30 years who have come from throughout Louisiana to participate in the groundbreaking science taking place here. And if you note, over 10,000 live outside the Baton Rouge area. It is a reflection on the quality and the opportunity that's presented to participants and patients here, that they will travel distances to participate in these kinds of clinical trials and research studies. Let me give you an example. This is a participant who signed up for what we know as the Heads Up study. His name is Timothy Novo. I should note, Timothy gave us permission to use his information. The study confirmed that bariatric surgery not only helps with weight loss, and many of you will associate bariatric surgery with weight loss, but to our surprise in the general scientific and medical community, it also happens to reverse or put type 2 diabetes into remission. And that happens within days after the surgery in most cases. A very surprising observation, but a very important observation in terms of how future treatments for diabetes and obesity can be developed. Getting back to Timothy, he lost 33 pounds. While he was in the trial, he also received free health screenings and tests, as all participants do. So any of you who have participated in a trial at Pennington will know this. You've gotten a lot of blood work and medical tests done for essentially free as part of the evaluation process. One of the tests that Timothy had was an EKG, where we measure his heart. This revealed a heart blockage. So we send him to his cardiologist. His cardiologist put 3 stents in. We're pretty sure that saved his life. So this is a man who came to lose a little bit of weight, participated in a study, had some tests, and discovers a condition that was looming for him in terms of potential, not just morbidity, but mortality. So currently we have 156 sponsored studies in progress at the center. 59 are clinical trials like this one, and many of them are recruiting participants right now. So if you want to sign up, we'll take your name and number. Some of the highlights of other research results discovered at Pennington are available on the 30th anniversary web page. One example is the Diabetes Prevention Program. This began recruitment in 1996. It has become a landmark study. Over 3,000 people participated. What this study showed was that moderate weight loss, 7% weight loss, that is about 14 pounds for a 200-pound man, coupled with some exercise and some coaching support, prevented and even reversed type 2 diabetes. That program is now being covered by Medicare because it was so successful. When you visit the 30 Years of Discoveries page, you'll also find out about how we are the primary nutrition research provider for the U.S. military, and how we help develop the first strike rations to keep war fighters healthy, both physically and mentally, under extreme conditions. You'll see we offer free Alzheimer's screenings every year. This is to help us better understand the warning signs of Alzheimer's disease and how to prevent its occurrence. You can read about how Pennington Biomedical contributed to practically all the key obesity and diabetes medications on the market today. There are many other discoveries as well. Now, all of these take time to reach the community level, of course. Data suggests it takes 18 years to get a treatment from research recommendation into everyday practice and then change how medical care is delivered. As an example, it took almost 20 years for the diabetes prevention program to go from an idea to a Medicare-covered service. So Pennington Biomedical is on the track and will continue to its focus on speeding up the research translation from bench to bedside so that we can achieve the goal of a healthier Louisiana. In the meantime, by visiting our website, signing up for newsletters, coming for educational events, even participating in a trial, as a bonus, you might find something new about your health, and that can help you live a longer and healthier life. Let me switch now to the economic impact. As we constantly monitor our progress towards discovering the triggers and new treatments for chronic diseases, we also monitor our work as stewards of the public support we receive. I'm pleased to tell you that the Pennington Biomedical business model is uniquely effective as an entrepreneurial business model. It provides economic impact for the state. Doc Pennington was a businessman as well as a health visionary. Consequently, our business model is designed to employ faculty members who are more like entrepreneurs and are responsible for generating their own grant revenue. And because they're all focused in one direction, that is studying chronic disease, and because we have a state appropriation that acts in a way like seed money, every gear works to keep the economic impact moving forward. As an example, on average, each Pennington Biomedical faculty member brings in over $600,000 in grants each year. This creates 5 to 6 jobs at the center. Another example, Eric Ravison is one of the world's leading obesity nutrition researchers. Dr. Ravison was recruited from private industry. It required $1 million in seed money from the state and philanthropy to bring him here and set up his lab. That investment has since attracted $65 million in grants to Pennington Biomedical and to Louisiana. I bring a slightly different mix of the same model. I come to Pennington with several federal and private sector grants and a team of scientific staff. But I too, as an entrepreneurial scientist, will be generating grant revenue each year to support my laboratory and research. In total, 450 jobs are supported at Pennington Biomedical, and 57 of these are primary researchers such as myself. So I hope you can see the potential of this model with primary researcher leadership to attract even more funding to the state. So does our business model work? Here's the data. From fiscal year 1989 to 2017, Pennington Biomedical received $257 million from state general fund and statutory dedications. During that period, we leveraged those funds to generate an additional $826 million for sponsored projects and research conducted in Louisiana by Louisiana-based scientists and Louisiana-based Pennington Biomedical staff. So the return on the Louisiana investment dollar is over 3 to 1. So for those of you who have 401ks, that would be a pretty good return on investment. As a bonus, these grants not only turned into good jobs for people at Pennington Biomedical, these are added economic benefits for other individuals. There are added economic benefits for other individuals in our community. For every $1 million we spend on research from federal and private grants, economists say we generate over 21 new jobs outside of Pennington, over $700,000 in new household income, and close to $2 million in new business sales. So what is the vision for the future of Pennington Biomedical under my leadership? Well, I've been here almost a month, so it's really an emerging story and has yet to be completely told. But I recognize that the infrastructure and the working model is here. We can easily pivot to address the needs of all of our publics and groups, including the citizens of Louisiana, the trial participants who participate in our research, and the science community worldwide. As I stated earlier, my goal is to increase Louisiana citizen awareness of the resource we have here at LSU's Pennington Biomedical. We also intend to continue the research, continue innovative new approaches, and we will continue to meet the challenge delivered by Doc Pennington 30 years ago. At that time, the state was facing fiscal crisis based on the 80s oil bust. When Doc Pennington wrote this memo that reads in part, "In formulating the original foundation, my only instructions were that this should be the biggest and best nutrition research center in the world." Now the state and the country, indeed, its physical crisis is based in part on healthcare costs. And we are uniquely positioned to help with that. Of course, no one has solved this chronic disease problem yet. Our immediate goal is to bend that chronic disease growth. The solution, we feel, lies in these breakthrough approaches, and breakthroughs are what our scientists do so well. With just a small investment on the state's part, we will pursue filling our capacity to bring in 40 more entrepreneurial faculty members in the next 5 years. Those new faculty members will support the critical mass needed to continue the scientific gains we've already achieved. And what new investigative ideas are in the pipeline? There are hundreds, but for the sake of brevity, I'll mention a few. One is finding ways to stop this obesity, diabetes cycle. One way to do this is to prevent the generational transmission of obesity from moms to babies. And we have a series of studies that are ongoing at the Pennington to address that important question. We need to find better treatments and possible preventions for Alzheimer's disease, such as blood pressure control. Again, we have studies ongoing at the Pennington to address that need. Knifeless bariatric surgery. I mentioned bariatric surgery previously. Some people get a little bit edgy when you think about bariatric surgery. How about knifeless bariatric surgery? Finding a way to mimic the results of bariatric surgery without having to do the surgery itself. And we have studies underway to discover how to do that. Formulation of a medication that provides the positive effects of exercise for those who simply can't exercise because of their conditions or their disease. Apps that estimate nutrients from just a smartphone photograph. The list goes on. Unfortunately, I'm running out of time, but I hope you'll invite me back soon to make sure your readers and viewers are exposed to more about what an amazing resource Louisiana has here, and to present on some of the details of these exciting new developments in the research arena, including results from the Department of Defense study that will be released later this spring, as well as the impact we are seeing from the $20 million statewide LeCats federal grant. Until then, thank you for your time and attention, and I think we have a few minutes for questions.